Assalamu alaikum. Today we are going to talk about rotator cuff muscles. What are they and how are they important? What are the clinical aspects of that and what are the diseases related to rotator cuffs and much more. So stay with me till the end of the video so you would be able to answer all the questions which comes in exam regarding rotator cuffs. So let's begin. What are rotator cuffs? Rotator cuffs are actually a group of muscles which include supraspinatus, infraspinatus, teres minor, and subscapularis. These four muscles sling around, or you can say attach around the head of humerus in such a way that they form a full rotation. So, and they keep the humerus of head inside the joint. Uh, as you know, your shoulder joint is actually a ball and socket joint, and ball and socket joints are highly unstable, and there are only two of them inside your body. One is your hip joint, and one is your shoulder joint. So ball and socket joint are usually unstable. So and since the mobility around your shoulder joint is very much increased, or you can say much more than your hip joint, so in order to compensate that mobility, this joint is highly, you can say, unstable. So to keep that humerus head inside the joint, these muscles are actually present. So they are called rotator cuff muscles. Here is the subscapularis muscle, here is the minor muscle, here is supraspinatus muscle, and here's infraspinatus muscle. You can't actually see it from the anterior side of your body. It's actually in the posterior side of your body. Some important clinical aspects of rotator cuff muscles. Supraspinatus muscle is the most commonly injured rotator cuff muscle. So if a patient comes to you with a rotator cuff injury, suspect supraspinatus muscle. And there's a test for checking the supraspinatus muscle integrity called empty full scan can test. The patient actually standing with the abducted arm, and then he actually rotates his arm in such a way that can is full and facing upward, and then after the movement ends it faces downwards, and you try to palpate the muscle in the scapular area. You will find a dip if the muscle is injured. If there is no dip, which means the muscle is normal. Then there's infraspinatus muscle. It's usually found in pitching injury, and the suprascapular nerve usually um, supplies it. And there's one thing more important in supraspinatus muscle, that is it is actually responsible for first 0 to 15 degree of abduction. So if this muscle is damaged, your first initial uh, movement of abduction is actually impaired. A person won't be able to abduct her arm if his supraspinatus muscle is actually injured. He needs some sort of support in order to execute that abduction. Then there is teres minor. It is usually injured in axillary nerve injuries. Since axillary nerve is present around deltoid, and it can easily get injured during IM injections, which are inserted in deltoid muscle. So it's very common in IM injections, and it actually adducts and externally rotates. It's actually abducts, not adduct. It abducts your arm. It's abductor. It takes your arm away from the body, not closer. This is my mistake. And then there is subscapularis muscle. It is actually supplied by two nerves, upper and lower subscapular nerves. So this is not important for you. As I told you, there are only two types of ball and socket joints inside your body. One is a shoulder joint and other is a hip joint. Hip joint is less mobile but more stable. On the other hand, shoulder joint is more mobile with less stability. In order to provide more stability, there are muscles present called rotator cuff muscles. So if one of the muscle get damaged, or you can say the muscle gets weaker, then there is a very common phenomena called shoulder dislocation. Here's a picture of a person to which I have performed the maneuver to correct that shoulder dislocation. And after performing that maneuver, I have actually tied his hand to his body in order to stabilize that hand for a few hours. After that, this arm sling will be removed. So I just add this picture just for your knowledge that how a person is actually how much instability is there. And there is another clinical aspect which people might relate to shoulder rotator cuff injury, but it's not a rotator cuff problem. There's a disease called frozen shoulder. It happens mostly in diabetic patients, and sometimes it can happen to normal persons as well. What happens in frozen shoulder is that person's shoulder actually gets frozen, or you can say get painful while performing movements. What happens is that the ball and socket capsule get adhesive, or you can say fibrosed in such a way that if a person try to move his shoulder, it is painful, which is worsen over time, but it resolves spontaneously within 1 to 3 years. Okay, we only give analgesics in these patients. Some doctors do prescribe steroids, but the point why I'm adding this slide in this topic is that frozen shoulder is not the disease of rotator cuff muscle. It's a disease of joint capsule, actually capsule and the ligaments surrounding it. So restricting its movement. In this condition, rotator cuff muscles are normal, but the capsule, or you can say the joint, is involved, not the muscles. So by this, I conclude this lecture. Please like the video if you found it useful. That's all. This is Dr. Omar signing off. Allah Hafiz.